On the new FDA-approved Alzheimer's drug.
Joining us now is our morning news medical contributor and Northwestern Medicine physician, Dr. Lauren Streicher. Good morning.
Good morning. Good morning.
So we heard about this. The FDA approved a new Alzheimer's drug. Talk about what's different this time around. What does this do?
Well, first of all, this was a very, very controversial move on the part of the FDA. What Aduhelm is, that's the trade name of the drug, is it's a monoclonal antibody that actually decreases the deposition of amyloid. Amyloid's that protein that clumps into plaques and clogs the brains of Alzheimer's patients. And just to be clear, this drug is not intended for the treatment of advanced Alzheimer's. It doesn't reverse any of the cognitive changes that have already occurred. It is intended to slow down the progression for people that have early Alzheimer's. But here's the controversy. The FDA requires 3 criteria to approve a drug. Number 1, is it safe? Number 2, does it work? And number 3, does it address an unmet need? Well, as far as the safety concerns, there's always a possibility of side effects, but overall the side effects of this drug are felt to be manageable. That's not the controversy. As far as unmet need, that's the big story. There's 6 million Americans with Alzheimer's. There's been no new drug in 18 years, so there's a huge unmet need. But the controversy is how well does it work? The experts all agree that this drug does decrease the amount of amyloid that's deposited in the brain, but in terms of actually slowing cognitive decline, well, the data is not really solid. But the FDA went ahead and approved this drug because there was this need, and they said, but we have to have further research. They're going to have ongoing studies. And this is really unusual. The FDA has said, and in the next year or two, if these studies don't prove that it actually decreases the progression of Alzheimer's, we're going to pull it from the market. Right. Now, so there's 2 groups of people that are like, it's all over this. This is a huge thing. There's the patient advocacy groups that say, oh my God, of course, you have to push this through. You have to fast track it. We have this huge unmet need. And then there are the people that say, are you kidding? We don't know if it really works. It's super expensive. It's like $56,000 a year. You got to get an infusion once a month, essentially for the rest of your life. So they say this was pushed through too fast. So huge controversy on this one.
All right, next up, FDA approves new oral pill for vaginal yeast infection, the VYI.
This is not nearly as controversial. This is pretty straightforward. And this is actually kind of big news in the gynae world because 3 out of 4 women do get a yeast infection at least once in their lifetime. And for a lot of people, it's a lot more than that. And it's miserable. It's itchy, it's icky. People hate yeast infections. And right now, if a woman gets a yeast infection, she has the choice. She can either use one of these, creams or suppositories, which is kind of messy. There is an oral pill that's been out for a long time that most women are familiar with. It's called diflucan, and this is one pill that you take. But the problem is that there's all these resistant yeasts that are emerging, and diflucan doesn't always work. So the new pill is called Brexafemme. And like diflucan, Brexafemme is a once daily, it's 1 day of an oral pill, 2 in the morning, 2 in the afternoon. Side effects aren't bad. About 15% of people get nauseated or might have a little diarrhea. But, you know where I'm going with this. The big issue with Brexafemme is it's expensive. It's like $350 for, one treatment, which is crazy. That's about 10 times more expensive than you're going to pay for another yeast medication. So clearly this is not going to become the first line treatment. But for women who are really plagued with yeast infections and who have those resistant strains, that's where you're going to see Brexafemme being prescribed.
All right. How about a sleep and diabetes study?
All right, this one is really kind of shocking in terms of the numbers. It's not news that we need to get a decent night's sleep and that people that get less than 7 hours of sleep are not only crabby and tired all the time, but they're also at higher risk for heart disease and gaining weight and developing diabetes, which in turn decreases life expectancy. But this was a big study that was just released that came out of Northwestern Medicine that looked at 500,000 people. And what they specifically were looking at is people with diabetes and the impact of sleep on people with diabetes. So there were 3 groups in this study. 1, people without diabetes who slept just fine, the control group. And then they had diabetics who didn't sleep, the insomniac diabetics. And then they had the diabetics who did sleep, who did not have insomnia. And this is what they found. If you compared the people with diabetes and insomnia to the regular people that did not have, to the diabetics that did not have insomnia, there was a 12% more likely chance that they would die over the next 9 years. But the big number is if you looked at diabetics who weren't sleeping compared to the non-diabetics, there was an 87% more likely chance of dying over the next 9 years. So this just emphasizes the fact that you gotta sleep. I mean, particularly if you're diabetic, you've gotta sleep, because this is gonna have a huge impact on mortality. But the truth is, even if you're not diabetic, you got to figure it out. You know, is it the snoring partner? Is it sleep apnea? Is it those all-night hot flashes for midlife women? You got to figure out why you're not sleeping and get a decent night's sleep.
All right, for more, you can check out drstryker.com or follow her on Twitter or Instagram. Thanks for being with us.
Thank you.
Thank you.
Hey, Anna.